Hey, welcome back into Ion Agriculture. I'm Britton Rucker. It's the #1 killer of calves, and it can strike fast. We're breaking down bovine respiratory disease with K-State's Dr. AJ Tarpoff and what you can do to stop it in its tracks. AJ, what are some early signs of BRD in calves that producers should watch out for?
So for BRD detection, I really like to work with producers to understand DART, D-A-R-T. Depression, so animals will get depressed, they'll hang their head low, their ears will be low, they just overall look a little bit depressed. A is appetite. Usually those animals start to go off of feed. R is respiratory rate, so they'll start to, because that's impacting their lungs, they'll actually start breathing faster. And then the last T from DART is temperature. They'll start running an internal body temperature over 104. So 104 degrees Fahrenheit, that's really where we consider that animal has a temperature and has an issue.
So what are some of the biggest risk factors that lead to BRD outbreaks?
So risk factors, really it comes down to those animals that if we commingle and put different groups of animals together, that has an opportunity to be able to mix and to be able to provide new avenues for those diseases to start to spread. So commingled, recently weaned or recently traveled animals. So when we have that maternal separation from the cow, we put that animal on a transport truck and perhaps transport that animal a long distance. All those are risk factors that we try to put together to realize how much of a risk is this animal of developing BRD.
Yeah, lots of folks thinking about weaning right now, so something to look out for, definitely. How important is vaccination and preventing BRD, and when should it be administered?
Vaccines are critically important to be able to develop that young calf's immune system as they grow and develop. Priming that immune system early in life is really our opportunity to be able to give the best opportunity for that animal to thrive later on in life. Ideally, we start early, 2 to 4 months of age, that we can introduce some of our first vaccinations into that calf. Then, prior to any of our other stressful conditions like weaning, we want to booster those vaccines. So pre-weaning, about a month, we can get a vaccine into them. And then before we commingle or transport or do any of those things post-weaning, we can also give a booster. For the rest of our herd, we're really talking about yearly vaccinations.
Yeah, AJ, I might have some people listening to this right now and think, shoot, I have a few of these in my herd right now. What treatment options are available once a calf shows some symptoms?
Thankfully, we have some fantastic long-acting injectable antibiotics that are available that really work extremely well whenever we treat those animals early in the course of disease. My best recommendation to be able to weed through all the options that are out there, go talk and have a very fruitful conversation with your local veterinarian. That valid veterinary client-patient relationship gives us the opportunity to be able to prescribe those products so you have them on hand prior to that animal getting sick, because early treatment really yields the best success.
Oh, AJ, thanks so much for coming on and chatting with me. Everyone stick around to Ion Ag. We'll be back after the break.